Hello everyone, coming to you from Italy. We're at the Thyroid Ablation Conference, and I'm seated here with Dr. Erivelto Volpi from Brazil.
Hey, hi Philip, how are you? Great pleasure to be here and share our opinions and learn a lot in this amazing conference.
Dr. Volpi, great to see you. Thank you for being here. I saw you last week in London for the World Congress on Thyroid Cancer. Here we are in Italy now at the TNT conference on thyroid ablation.
Yes, it's a huge opportunity to be here and to hear the thoughts of the great experts in this field. It's wonderful.
And it's exciting because I think more than ever, a lot of conversation at the conference is talking about treating thyroid cancer with ablation.
Yes, this is a new field in the treatment. We can, in some patients, in selected patients, we can offer for those patients the opportunity to avoid surgery using thermal ablation technologies.
Yeah, and I think it's so important to emphasize just that it's a viable option for patients who have thyroid cancer.
Yes, the most important is the selection of the patients for appropriate cases. Usually nodules up to 1 centimeter located inside the thyroid parenchyma. The results in terms of the treatment is exactly the same. The outcomes of the treatment are exactly the same of a conventional surgery. It's the most important. RFA in proper selection it has the same results, the same outcomes of the surgery.
Ablation's been a treatment option for thyroid nodules in Brazil for over 10 years now. The rest of the world's starting to catch up. The U.S., we're seeing some countries in attendance here, say from Indonesia, who are just starting out in a country, ablation for thyroid. What lessons have you learned in Brazil that you could tell somebody in Indonesia, a new doctor, treating ablation? What could you tell them that you learned in Brazil over the last 10 years to make their launch of ablation in their country more smooth?
Yes, the most important is when you begin to do RFA, you should select the patients. Start always with benign nodules and not so huge nodules. You can start with patients that have cosmetic or symptomatic nodules. For these patients, RFA for benign nodules, when you are starting your learning curve, it's a very good option, not only for the patients, but also for the doctor that is starting to do this procedure. After you get more acquainted, you get more experience, you can be confident to do more challenging cases.
If somebody wants to get in touch with you, how should they reach you?
Oh, they can reach me by Instagram, Dr. Erivelto Volpi, or can reach me by Facebook also, Erivelto Volpi, and can reach me by email, eriveltovolpi@gmail.com.
Thank you, Dr. Volpi.
Great pleasure. Thank you so much.
Everyone, see you from Italy.